Nasogastric tube NG tube insertion is a procedure where a tube is passed through the nose into the stomach for feeding, medication administration, gastric decompression, or lavage. Indications: uses of NG tube. Nutrition support for unconscious or swallowing impaired patients. Gastric decompression to remove stomach contents and prevent distension. Gastric lavage, stomach washing in cases of poisoning or overdose. Collection of gastric samples for lab analysis. Contraindications: esophageal atresia, narrowing of the esophagus, severe facial or nasal trauma. Equipment needed: NG tube, plastic or rubber lubricant, water-soluble syringe, 20 to 50 milliliter stethoscope, glass of water for conscious patients, litmus paper for pH testing, adhesive tape for securing the tube. Procedure for NG tube insertion. Preparation: explain the procedure to the patient. Perform hand hygiene and assemble the equipment. Position the patient semi-fowlers if conscious, lateral if unconscious. Measuring the tube length. For adults, measure from nose gives earlobe gives zip hole process. For infants, measure from nose gives earlobe gives midpoint between zip hole and umbilicus. Insertion: lubricate the tube tip. Insert into the selected nostril while the patient hyperextends their neck. Advance the tube until it reaches the oropharynx. Patient may gag. Ask the patient to swallow sips of water while advancing the tube further. Stop if there is resistance or excessive gagging, and try the other nostril if necessary. Confirming placement. Aspiration test. Draw stomach contents and test with litmus paper. Should turn red. Air injection test. Inject 5 to 10 milliliters of air and listen with a stethoscope for a whooshing sound over the stomach. 10-ray most accurate method. Securing the tube. Tape the tube to the nose and secure it to the patient's gown. Connect to feeding or suction as required.